Good evening, friends. Here is a fast-paced, high-density video covering the definitive breaking medical news and FDA updates for August 1, 2026. The billion-dollar Mediclaim shakeup. New insurance rules issued by the General Insurance Council are officially taking effect today, radically changing how hospital admissions work. Under the new directive, hospitals are banned from admitting patients for uncomplicated fevers, forcing them to utilize outpatient treatment instead. Admissions will now strictly require documented danger signs like internal bleeding, continuous vomiting, or severe abdominal pain. The conflict. While the policy aims to block unnecessary hospitalization, medical bodies like the Indian Medical Association (IMA) are pushing back, fiercely warning that genuine mediclaims could be wrongfully denied by rigid insurance adjusters. Pharma breakthroughs, new FDA monsters released. The lipid killer. The FDA has officially greenlit Lipfendra, enlicitide, tablets. This is the first highly anticipated oral PCSK9 inhibitor to drastically slash LDL cholesterol, bad cholesterol, in adults suffering from severe hypercholesterolemia. It completely replaces the need for biweekly injections with a simple daily pill. Advanced breast cancer victory. Retorpic, gedatolisib, has secured FDA approval for patients with HR+/HER2 advanced or metastatic breast cancer. In the Phase 3 Victoria-1 trial, this next-gen multi-target PI3K/mTOR inhibitor slashed the risk of disease progression by a staggering 76%, extending progression-free survival to 9.3 months compared to just 2.0 months on standard hormone therapy. GSK's lung cancer milestone, striking 2 months ahead of schedule, the FDA approved Jadaytro, zidesamtinib, for advanced, previously treated ROS1-positive non-small cell lung cancer. This therapy boasts a massive 48% intracranial response rate, meaning it directly crosses the blood-brain barrier to shrink brain metastases. CRISPR for toddlers. The gene-editing cure Casgevy has officially had its FDA approval expanded to children as young as 2 years old for sickle cell disease and beta thalassemia, allowing early intervention before irreversible organ damage sets in. The clinical pipeline, what you need to know. The end of infusion chairs. Oncocare just went mobile. Sarclisa echina, isatuximab, has just transitioned into real-world hospital deployment following its approval as a subcutaneous injection for multiple myeloma, shifting patients away from hours-long 4-infusion chairs to a rapid, under-the-skin injection. Stem cell transplant overhaul. Healthcare networks are implementing Trexi, or CAR-T, this week. This precision-engineered cell therapy separates donor cells to double the survival rate free of chronic graft-versus-host disease, GVHD, to 78%, versus 38% in conventional transplants. The next HIV heavyweight. Keep your eyes on August 27. Gilead Sciences' Bictegravir/lenacapavir, BIZ/LN, single-tablet regimen is under priority FDA review. It pairs a powerful integrase inhibitor with a first-in-class capsid inhibitor, offering a bulletproof option for virologically suppressed HIV patients. Global Health Watch, outbreaks and threats. Egg recall and salmonella outbreak. The FDA and CDC issued an urgent update confirming 98 illnesses and 26 hospitalizations across 17 states traced back to a massive shell egg recall by Midwest Poultry Services. Viewers should check their cartons immediately. The global cancer alarm. The World Health Organization, WHO, has issued a stark warning: global cancer cases are projected to nearly double by 2050. The WHO highlights a massive survival equity gap. 87% of breast cancer patients survive 5 years in wealthy countries, compared to just 42% in low-income nations. The silent misfolded protein. New endocrinology research published this week reveals that misfolded insulin within pancreatic cells is a primary driver of type 2 diabetes, steering the blame away from lifestyle alone and opening the door for target cell therapies. Medical jurisprudence and scandals, the viral segment. The NED 2026 leak exhumed. In medical education news, the CBI's official charge sheet has exposed the exact mechanics behind the NEET UG 2026 paper leak, pointing to critical internal lapses within the National Testing Agency, NTA, and a complex network of coaching institute operators. Concurrently, the Bombay High Court forcefully junked all retest petitions, slapping fines on applicants. Protecting doctors. In a landmark ruling for medical professionals, the Patna High Court ruled that criminal prosecution for medical negligence cannot proceed without expert medical opinion confirming gross culpability, establishing a massive legal shield for practicing doctors against arbitrary harassment. CRC. The FDA approved Simple Screen CRC, a blood-based screening test for adults 45 years and older who are at average risk for colorectal cancer, CRC. Simple Screen CRC joins Guardant Health's Shield test, which was the first approved blood-based screening option for CRC. In recently updated guidelines, the American Cancer Society said blood-based screening tests are not recommended as a preferred option, but can be offered to individuals who decline or can't complete preferred screening tests. MedPage Today. Hepatitis. Global hepatitis B infections decreased 32% each year since 2015, while hepatitis C-related mortality declined 12%, according to a World Health Organization report. MedPage Today. Pancreatic cancer risk. Patients with new-onset diabetes needing rapid treatment escalation or an intense initial regimen had an increased pancreatic cancer risk compared with non-diabetics, a Korean cohort study found. Gut. MedPage Today. Outro and call to action. Which of these medical updates do you think will impact healthcare the most? Drop a comment below, hit that subscribe button for daily medical breakdowns, and I'll see you in the next video. Disclaimer: compiled information. This content is for educational purposes and is not a substitute for professional advice. The audience must verify the contents before use. The creator, publisher, and YouTube will not be responsible for any harm.